Are you looking for a transformational space to reconnect with your hormones, your cycle, and your inner power? Then join me as I launch the Wise Woman Rising program, a 4-week journey to reclaim your body's wisdom, to honor your story, and rise in your power. I'm Dr. Tiffany Keenan, and I'm so glad that you're here. Today, I'm honored to be joined by wise woman Treena Sutherland, who will be sharing pieces of her story, her challenges, and more so her insights from the work that she's been doing in the hormone field. These conversations are part of a greater movement that reminds us that healing is not linear and that through sharing, we rise together. So, Treena, thank you so much for being here. How are you feeling as we begin?
Oh, I feel pretty good tonight. It's a nice sunny day and warm out there. I'm inside in the air conditioning, but you can see a little bit of the sun behind me. So still enjoying this evening. So it's a great day.
Well, thanks, Treena, for being here. So, if you can just start by sharing a little bit of the work that you do and some of the experience that you have um, working with women and their hormones over the years.
Sure, sure. So as you and I both have been working together with this for quite a little while now, but I began back in 2009 when I opened up my pharmacy in Miramichi here, and I had taken a particular interest at that time in compounding pharmaceutical medications. And I went off to the U.S., where oftentimes we go to get a little bit more of the unique side of our training. And one of the things that I went off to do was take a course. And within that was one of my first opportunities to be introduced to hormone training and talking with mostly women. I did a little bit of male training, but I felt more passionate about the female side of things. So I kind of leaned into that. And when I opened the store in 2009, I began doing some counseling with some ladies and with some hormone products. I was fortunate enough at the time to have some physicians that were willing to give it a shot with me and team up with me. And from that time forward, we've just moved along utilizing the knowledge that has progressed, the different courses that have come along, and adjusted as things we learn. And that's where I'm at today, with doing all kinds of wonderful products with you, and as well as a few other physicians, of course, that still are with us. But nonetheless, that's kind of my little story with where my journey began with, you know, hormone replacement therapy in ladies.
Well, thanks, Trina. And, for me, because I started around 2016, 2017, and I still remember sitting down with you and saying, Trina, let's talk about these hormones and what can be done. And I think like you've said, we've seen our practices evolve from what we used to use. And now, there's so much more about the safety. And then there's more uses. People are feeling more comfortable with products too,
Yeah.
especially things like, testosterone, right? Which, it takes a little while for people to kind of get adapted. But we know these products can be so beneficial and so safe, for individuals. And I'm so glad that we can share both of our combined wisdom. So if you can tell us, like, some of your basically the tricks of the trade, some of the key points that you've seen that you think can really help women.
For sure. So I thought I'd stick to the nitty gritty of what it's like in the trenches of the pharmacy most days, and what often the things we talk about most with the patients that we're working with, as well as, a couple of little helpful hints. So one of the first things I thought I'd mention is the best timing. There's not a one size fits all timing for every medication. And particularly, there's a couple of hormones that do serve us better when we take them at certain times of the day. So, for example, and what we often see prescribed now, less than in the past, is, for example, the progesterone. Progesterone, when we're utilizing it, we like to see it given at bedtime. And the reason, or the kind of the thoughts behind why this might be better is, one, progesterone can help with your sleep, which is big in this patient population. A lot of us are struggling with our sleep. And secondary to that, the vasomotor symptoms there that go along with the perimenopause, menopause symptoms, like your night sweats or even like just some hot flashes, those often are more attributed to lower progesterone levels. So if we can get that progesterone in and hitting at bedtime and getting throughout the night, we can see some improvements there. And if you happen to be prescribed supplements, there's a couple of those as well that are better taken at night. We see magnesium prescribed, or I often recommend it a lot for ladies. I'm sure I've seen a few prescriptions come my way from you with that, but also just in particular, again, it's a helper for sleep. It can also help with those leg cramps that we sometimes get, or those restless, jumpy legs. So that's another one that we'll see oftentimes that we encourage to take at the bedtime. So it's not just the prescription side, but it's also good to double check on supplements that are coming through as well. So that's the first. There's another thing that happens often, and I know that you can attest to this, I'm sure, Dr. Keenan, but one of them being, and I'm calling it the timeline of your medication, meaning some folks, when they start their product, you might notice it immediately. You might notice it within a day. You might notice it within 2 days, that all of a sudden you feel so much better, which is exactly what we love to hear, but that's not everyone's experience. And a lot of times we have folks that it can take time for that medication to take effect. And I'll get asked, when they come back for a refill, or when a person comes in, Treena, I don't know if this is working or not. I don't know if it's making a difference. I don't really feel that much of a difference. I'm still having a lot of symptoms, et cetera, et cetera. So what sometimes I'll recommend, depending on, the person and their type of ways, is to do either a paper journal or on your phone. So many of us have our phones at our fingertips now. Just keep a little note in your calendar app or on a journal that you keep on by paper, and just write down how your mood felt, how many hot flashes you had today. I didn't sleep well last night. Keep a little eye on things. And sometimes what we'll notice is that will minimize over time in 4 to 6 weeks. And the reason I suggest that is because I've had a lot of folks that have come back to me after a couple of months of not taking their treatment and say to me, you know what, that really was working. I shouldn't have stopped. I should have kept going. Now I'm back to the drawing board. And that's not really true. Like, we're at where we're at. We'll roll with it. We've got this. Let's keep going. However, if we keep at it, we often will find that you feel better than you realize. And it's just that yesterday was a bad day and you had a bunch of hot flashes just because maybe your body had a surge of hormone or something of that nature that just naturally happened because of our cyclical behavior in the women's body, especially when we haven't quite hit full menopause yet. So that one there is a big one that I find helps a lot of ladies in particular find their way with a comfort and realization of where we're at with how well the hormone is working. Because as much as our labs do help us, as you and I both know, a lot of this is about how you feel, how it's working, how many symptoms of each type of thing related to hormone therapy you're still having. So that is kind of in my opinion, and you can correct me if you find it different, but I say it's always about 70 to 80% of the story, and our labs just help us define the rest. And that's a great way of knowing and helping ourselves get on to the track of knowing what's happening and how it's happening, because we lose track. I don't remember what happened 5, 6 days ago,
Yeah,
but
and
I
I like
certainly
this.
remember what happened this morning.
But I like this, Treena, because whenever, like, when people start and stop a medication, it's good to keep track, but in particular with hormones, because, we all know the woman that starts estrogen, estradiol, and then the hot flashes are gone in 2 days. And it's like, it's amazing. But for some things, like progesterone can take a while to kick in. Testosterone can take many months. Like I tell women with testosterone, we got to give this 3 months. Like this is a slow release kind of medicine.
Mhm.
And so it's becoming familiar with their bodies. And there is an app, actually, I will share it. So Dr. Louise Newson in the UK, she has an app that you can just get for free online, and it has your symptom questionnaire. And then you can go and do the app again, and it will kind of track things a little bit with time.
Oh,
So
that's a great idea.
yeah, so that can be helpful. And we all know too, like I'm glad you brought it up, like perimenopause is a different situation than menopause,
Yes.
because when the hormones are done, it's a little more straightforward. And,
Mhm.
even as a providers, it's a little easier to deal with menopause. Perimenopause, which is like from late 30s until mid 50s,
Mhm.
it's a time of hormone fluctuation. So it's really watching yourself, seeing how you react, and knowing that how you are at 48 is going to be different than at 52. Or
Correct.
even being 51 to 52, you can go through a huge change. And that's why, listening, and, you and I spend a lot of time talking to women, because we need to hear the story of what's going on, because hormones are one part of it, but life stresses, things that are going on with family, all other, like food, nutrition, exercise, all of that has its role to play.
Mm.
Um, but when people come back to the journaling, I'm glad you mentioned that one. That's one.
Yeah. And like I always said, before you were here and doing your practice with this, when ladies would come in and I would do assessments and then work with physicians after the fact. I always said when a younger lady came in, I would I'd be like, oh no, okay, like because it's harder because of the nature of our body as females, where we're not fully, unless they've had a hysterectomy or something of that nature, it's a little different. But when you're working with someone who's still having either a cycle or a weird cycle or something of that nature, by weird I don't mean that, but you know what I mean, a cycle that isn't the traditional 28 to 35 day cycle. I should use better words. But that's it's harder, and it's harder to get everything leveled out for people that are cycling because of the nuances, we'll say, within that. So yeah.
Definitely. Mhm.
Yeah, so I did have one more thing that I was going to talk about with regards to the the drug and hints and tips and tricks with that, and it's with regards to two things: placement of the product and the size of the dosage form. So I know that sounds weird to those of you who aren't in the medical field, but I'll start with the placement. Um, Before we got on here, Dr. Keenan and I were just chatting about, you know, how the hormones are best absorbed, especially when utilized topically, and meaning they're put on the skin or on a mucosal membrane, meaning either inside under the tongue or usually vaginally in that case. So that's a membrane that is a little bit easier to absorb through than the skin itself. Now, that being said, hormones like fat. And as much as none of us like fat, we need a little bit of fatty tissue to place the hormones if we're placing it on a topical area. And we were discussing earlier, especially when we're utilizing some testosterone therapies, and generally in women, like Dr. Keenan just had mentioned, it can take a long time for your testosterone levels to increase. One is it just takes time in women to get them there. Two is because we're not whacking you with massive doses of testosterone. We're starting with a nice, easy, low dose, maybe increasing slightly over time, but just building, as opposed to putting a whole bunch in and then hoping for the best. because, and doing it day in, day out, because we're not trying to, you know, do any sort of hormone conversion therapy. We're trying to do hormone replacement therapy. So there's two very different things there. So by placing the hormone, if it comes as a cream or a gel or even a patch, it's recommended, usually patches, where they go, and we'll stick to those recommendations. But you never know, that could change in the future. But with regards to especially gels or creams, it's ideal to place them on an area that has a little bit of fat and in the same place on each time with each application. So generally, we're at the point now that we're choosing the inner thigh. And that's mainly because if the testosterone that you're applying topically, even though it's low dosage, happens to cause a little bit of hair growth on the inside of your thigh, it's not the end of the world. You know, most of us utilize products to remove hair if it's unwanted for you. So you just go ahead and utilize that same method that you would have used in the past. So that's one of the things when it comes to the placement and the dosage itself. And then the second component that I am a bit more passionate about, or I guess I feel it's important, is the size of the amount of the dosage. Now, you might think more is more. I want more. I want the most amount of hormone I could possibly get on me. So I want to take a bath in this. But the trick is especially when it's products that I'm making rather than using commercial products, and this is sometimes the value of a compounding pharmacy, is we can make a more concentrated product, meaning it's a higher strength, it's strong, but it's in a small volume. So I try to keep the volume that you would apply to either your thigh or the vaginal area or wherever it is that we're recommending to apply it, to 0.5 ml maximum. Now, 0.5 ml, it comes out to being about the size of a pea when you want to compare it to something. So with that being in mind, the amount of the size of a pea to rub in onto the inner thigh, or to put on your finger and rub into the vaginal area, or slightly up inside the vaginal canal area to get inside further, is much easier to apply than, you know, a handful of gel or something of that nature. And there's less then that would, you know, absorb onto your pants or absorb onto your nightgown or absorb onto your underwear. And you're losing less of that dose. So hopefully getting more effectiveness, and mainly it comes down to too, a little more value for your dollar spent. So, you know, we're all looking to make sure that we get the best value in all ways. And I want to make sure that my products, and that I would either use myself or those that I would have other folks using, are going to be the most effective that we can have them be, and with the least amount of waste and loss that could happen for you on that situation. So that's that story.
Yeah, and I think that's important, Treena, because it's also kind of the efficiency of the delivery. Because what I see with patients is if they're losing the dose for whatever reason, then and if I'm trying to say, well, are they getting it? And if I do a blood level, but if they've lost it because of the type of application, then that's not always a good thing either. You know, for example, like for some women, when the patches fall off and then they have to change it, or they're trying to stick it back on with tape again, then that's not a super effective means. Then we have to look at something different. And so it's good for women to know that there are a variety of ways. There's also, like, you know, we use patches, we use creams, gels. There still are tablets, right? And there can be times that estrogen can still be recommended through oral absorption if it's not getting absorbed through the skin, because there's people. And so that's why it is important that we do work with the patients. We do blood levels to ensure that they are absorbing, because I must admit, like, you know, I've seen many women that don't absorb through one method, but we switch them to another method and then they're absorbing. And that's also when they come in and they say, my hormone's not working. well, then that's why we do want to test just to make sure absorption. So
Exactly.
such a great thing to bring up. And my one, I'll add a pearl in here too, Treena, because I'm always learning about hormones, and my preceptor, my teacher that I'm still learning, because I was starting to see a lot of fluctuations in blood levels on a few individuals. But also when a woman goes for her blood testing, you have to think about, where was she, what products is she taking, when
Hmm.
did she apply them? So if
Yeah.
someone, my last patient, she's on an estrogen patch that she uses twice a week, and the numbers didn't go up a lot, but we changed, the day was different from when we measured the testing. So,
Oh, yeah. Okay.
so those are things. So now I'm actually in my practice too, I'm standardizing if whatever they're on, and we'll get them to go at a certain time of the day just to make sure that that's standard. So these are wonderful. I'm so glad that you shared, these tips of basically the timing of the day, um, the type of preparation that's used, and then monitoring your symptoms with journaling. Because all of these things are going to help to empower women, right? To realize that every body is unique, right? Uh,
Exactly.
because again, we all want to rise. Like you and I, we talk so much and we work together on the latest things. Like, even when we did our estradiol face cream, Treena, remember?
Yes.
Yes,
Yes. Yeah. We're still using a little bit of it, but
that's right.
it's, yeah.
But there's so much. And so working with practitioners that, we look for the latest. And if Treena hears, or if I hear, we'll share that information, because again, we want women to rise. We want them to feel amazing. And we just want to make sure that their voices are heard. So,
Absolutely.
oh, Treena, thank you for sharing your voice tonight. And hopefully we'll have many that will join for the Wise Women Rising program. And details will be posted. It's going to be starting next Wednesday. And thanks again. And someday I think I think we need to do a preparation and application video together. So I'm going to add that to our list of things to do.
Sure, we can, and I'll try. We'll have a big chat about how to make it all happen, and
Yes,
we'll maybe bring some dosage forms and show them even, and see what we
exactly.
can, let people realize how many options are actually in existence.
Exactly. Yes. All right. Well, thanks so much, Treena. Thanks for your time. Have a wonderful night.
Thank you. Have a wonderful evening as well.